Hello everyone, myself Satish Kudodgi. Welcome to KNO Academy YouTube platform. In today's classes I am going to discuss personality disorder. In previous class I have already taught you cluster A personality disorder. In today's classes I am going to teach you cluster B personality disorder. As usual, first we will learn MCQs and we will discuss theory part again and we will solve those MCQs. Okay. The first question is, which of the following is a subtype of dramatic or emotional personality disorder? Okay, which is included in cluster B. Option A is saying paranoid personality disorder, option B is saying schizotypal personality disorder, option C is saying histrionic personality disorder, option D is saying schizoid personality disorder. So okay, you mark your answer. We will see the next question. People with a borderline personality disorder often exhibit which of the following characteristics? Option A, unpredictable and impulsive, option B, uninhibited and promiscuous, option C, demanding and angry, option D, sadness. Okay, mark your answer. We will discuss the answer later. Which of the following personality disorder is the best diagnosis for Claude? Claude goes to great lengths to be the center of attention. He announces his views and feelings with a great drama. However, one soon suspects it is only for effect and he seems willing to say or do almost anything to get others to pay attention to and like him. Option A is saying histrionic personality disorder, option B is saying borderline personality disorder, option C is saying narcissistic personality disorder, and option D is saying paranoid personality disorder. You mark your answer. We will see the answer later. An inflated sense of one's importance is seen in which of these personality disorder? Okay, option A, antisocial personality disorder, option B, schizoid personality disorder, option C, borderline personality disorder, option D, narcissistic personality disorder. Okay. The next question is, the client with the antisocial personality disorder is, option A, suffers from great deal of anxiety, option B, is generally unable to postpone gratification, option C, rapidly learns by experience and punishment, option D, has a great sense of responsibility towards others. Okay, you mark answer for all these questions. We will discuss the answer at last. Okay, today we are going to learn about personality disorder, cluster B personality disorder. Okay, we will recap what we have studied in last class. In last class we have discussed what is personality, what is personality disorder, what is full form of DSM and ICD, and what are the classification of personality disorder. So what is the personality? Personality is the unique character which includes behavior, thoughts and speaking ability of the person. If behavior, thought and speaking ability of the person is abnormal, then it is called as personality disorder. What it is? If the behavior and thought and speaking ability of the person is abnormal, if it is abnormal, then it is called as a personality disorder. So what is the DSM and ICD full form? DSM is Diagnostic and Statistic Manual, ICD is International Classification of Diseases. So we have seen the classification in last class, that is cluster A. In today's classes we are going to discuss cluster B. Okay, we will see the cluster B personality disorder. So in last class we have discussed cluster A personality disorder. In today's class we are going to learn cluster B personality disorder. In cluster A, paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. In paranoid personality disorder, the person is always suspecting others, always doubting others, like somebody will kill me, somebody will harm me. In schizoid personality disorder, the person is introvert. He doesn't want any friends, he wanted to be alone. Okay, in schizotypal personality disorder, the person is always having magical thinking. Okay, magical thinking. So what it is? The rain is coming is because of me. Okay, introvert is first rank Raju. Okay, in today's classes we are going to learn the cluster B personality disorder. In cluster B personality disorder, there are 4 personality disorders are there. One is antisocial personality disorder, one is histrionic personality disorder, one is narcissistic personality disorder, and one is borderline personality disorder. Okay, as usual in last class we have remembered some words to fix in our mind. So for first one is antisocial personality disorder. One is antisocial personality disorder. Okay, one is antisocial personality disorder. Second one is narcissistic personality disorder. In third, histrionic personality disorder. Third is histrionic personality disorder. Okay, fourth is borderline personality disorder. What is borderline personality disorder? Okay, I told you to remember one word for each personality disorder in previous class. In the same way we are going to remember one in the same way we are going to remember same words for these disorders also. In antisocial personality disorder, we are going to remember that the person will break rules. Okay, what it is? Break rules and violates rights of others. What it is? Violates rights of others. Okay, violates rights of others. And no control over gratification. That it is no control over gratification. Okay, no control over gratification and harm others. Okay, he is harm others for his own benefit. Harm others for own benefit. Okay, harm others for own benefit. What is antisocial? The word antisocial itself is saying he is going to break rules, he violates rights of others, no control over his gratification, harm others for his own benefit. Okay, this is about antisocial personality disorder. Next one is we are going to see histrionic personality disorder. The word you are supposed to get remember is constantly seeking behavior. What is constantly seeking? Constantly seeking attention. Constantly seeking attention from others. Okay, in narcissistic personality disorder, in this one you have to go, you are supposed to remember. Okay, this person will say always I am correct. Okay, this person will say I am correct, I am genius, I am only everything, I am God, like that he is telling. He's always needs admiration. Everyone should praise him. You are God, you are king, you are everything. So in this one, this person you are going to remember I am correct and others all are wrong, means I am only best. Okay, like that he is telling. Okay, this one suppose you are going to remember. He needs admiration. What he needs? Admiration. Okay, he always needs praise from others. In borderline personality disorder, you are going to remember two words. One is impulsive. Okay, in impulsive and risky behavior. Okay, impulsive, risky behavior. Okay, one word. And another one is suicidal attempt. Okay, suicidal attempt. Okay, what the words you are supposed to going to remember? In antisocial personality disorder, you are supposed to remember about he will break the rules. Okay, whatever the rules are there, he will break, violate the rights of others. Okay, and no control over his gratification. We will discuss in detail about what all are these things. Okay, and he will harm others for his own benefit. And next one is narcissistic personality disorder. In narcissistic personality disorder, the person is saying I am only correct, I am only God, others are wrong, and I am only genius, like that he is telling. Okay, in histrionic personality disorder, already constantly seeking attention from others. Okay, constantly seeking attention from others. In borderline personality disorder, the word is impulsive and risky behavior, and suicidal attempt. Okay, these words you have to fix in your mind. So we'll discuss in detail about this personality disorder. First one, antisocial personality disorder. In first one is antisocial personality disorder. As I already told you, this antisocial personality disorder person always break rules in the society. Okay, whatever the rules are there in the society, he break rules. For example, if there is a no smoking board is there, no smoking board is there, then this person will smoke there. If there is no parking board is there, this person will go and park his vehicle in the no parking this one board, wherever it is there, he will park his own vehicle in the same place. Like that he is there, and this person is having no control over gratification. What it is? No control over gratification. Okay, anything comes in mind, he needs it. For example, he needs a car now. Okay, he needs a car. By any chance he is going to get this car by, for example, like here, stealing. He will steal money, he will rob the bank, and he will get the car. So that is what it is, no control over gratification. He has no control over his gratifications. Okay, and more important thing is harm others for his own benefit. He will harm others. He is going to break others' leg for his own benefit. Okay, he will harm others for his own benefit. This is main thing about you are supposed to remember about antisocial personality disorder. And another things we are going to discuss is his disregard. See, his disregard for others needs or feelings. He is not worried about what others are needed, what others needs, what are the other feelings. He doesn't worried about others. And this person is persistent lying and stealing. He is ready for stealing because he wanted to fulfill his gratification. And this person is having recurrent problems with the law. Yes, of course, because this person is harming others and he is breaking rules in the society. He is always having problems with the law. And repeated violation of rights of others. This one I already told you. He violated the rights of others. Because he never worried about, he is disregard about others' needs and feelings. That's why he is violates the rights of others. And this person is always aggressive and always show violent behavior, disregards for safety of self and others. Okay, he is ready to harm others also and himself also. Okay, himself or herself, he is ready to harm himself or herself and others also to fulfill his own benefit. For his own benefit, he is ready to harm others. Okay, for his benefit, he is going to break others' legs also. Okay, the term for antisocial personality disorder is they will call sociopath and psychopath. You may be heard in society like they were telling, yeah, he is a psycho. Okay, then they are telling that this is the antisocial personality disorder. If they say he is like a psycho, then they are conveying that he is an antisocial personality disorder is there. One more thing I want to tell you. The psychologist, they compare antisocial personality disorder with the narcissistic personality disorder. Okay, narcissistic personality disorder. Why? Because in narcissistic personality disorder also person is same only, but there no harm. He don't harm others. Okay, he don't harm others. So psychologists what they will do, they compare narcissistic personality disorder with the antisocial personality disorder. Okay, they compared antisocial personality disorder with the narcissistic personality disorder. Okay, we'll see next personality disorder. I hope you understand about the antisocial personality disorder. So next is histrionic personality disorder. Okay, histrionic personality disorder. I told to remember one word, that is constantly seeking behavior. What it is? Constantly seeking attention. Constantly seeking attention. Okay, this person, he is ready to do anything to get attention from others. Okay, most best example is he become ill. Okay, he become ill. Like he will tell, I have stomach pain. One day he will tell I have stomach pain, and next day he will come with a bandage over his head. Okay, bandage over his head. He will tell that I have a fracture. Okay, when you open, there will be no fracture. Just he is doing to gain attention. What it is there? To gain attention. And most important thing is by his physical appearance also. Dress code. He dressed in such a way that everybody attention should be towards him or her. Okay, that one is dress code. The different dress code he will follow so that he should gain attention from others. Okay, we'll see the constantly seeking attentions. Okay, the constantly seeking attention. In this one, histrionic personality disorder, the person is always seeking attention from others. Excessive emotional. Okay, for one small cut in his hand, this person will cry for 3 days. Okay, this person will tell, I have small cut in my hand, there is so much of bleeding is there. And this person will tell, I have so much of bleeding is there, that's why this person will cry 3 days. This is excessive emotional and excessive dramatic. Why he is doing that? Just to gain attention from others. Okay, just to gain attention from others. See, next the point is saying, speaks dramatically with a strong opinions. He is having strong opinion. I have cut in my hand and there is a large amount of bleeding is there. Okay, he is telling that he speaks with a strong opinion. His opinion is there is so much of bleeding is there, but a few facts or details to back them up. When you open that cut, there is a small cut is there, so that there is no possibility for large amount of bleeding. Okay, there is no evidence to support it. That is what I am conveying you. And this person is easily influenced by others because he want to gain attention from others, and excessive concern with the physical appearance, especially he will with a dress code, he wanted to gain attention from others. So I hope you understand, this person, the main motive is to get attention. In question if you find attention, you can directly go to histrionic personality disorder. I hope you got what is histrionic personality disorder. The third is narcissistic personality disorder. So this is the most important and most interesting personality disorder. In this person, the person thinks I am correct. See, this person will say I am correct and others are wrong, completely wrong. I am only correct, others are wrong. This person thinks I am correct and others are wrong. This person is always egoistic. You can say in a society they will say that person is having more attitude. Okay, this is the person, that person is having more attitude. Okay, this person always want admiration. What is admiration? Praise. Everyone should take his name. Okay, he is very good, he is best, like that everyone should praise him. Okay, see in this slide also it is saying belief that you are special. Belief that you are special and more important than others. I am only correct, I am only genius. If you say him, WHO is saying there are 6 steps for hand washing. Okay, for I am just explaining an example. If you tell him WHO is having 6 steps of hand washing, okay, then this person will say, what he will say? No, there is only 1 step, that is said by me. If he says maybe WHO is wrong, I am correct, like that this personality disorder person will say. He is always tell he is special and he is more special and more important than others, and he is correct and everybody are wrong. And he is having fantasies about power, success and attractiveness. So he is having fantasies about power, success and attractiveness, and failure to recognize others' need and feelings. Okay, this is also correct. In this personality disorder also he cannot able to recognize others' needs and feelings, and exaggeration of achievements and talents. What is exaggeration? He will tell multiple times, I have done like that, I have achieved this one, I have selected in so many exams, like that he will tell. He exaggerate the achievements what he has done in his life. Okay, this is about this one. And expectation of constant praise and admiration. Everyone should praise him. Everyone should praise him, like that you have done so much thing, you are the only genius, you are the king, like that we are supposed to tell this person. And what is arrogance? Gamandi. You can heard the word gamandi, that is he is always very arrogant to others. And unreasonable expectations of favor and advantages, often taking advantages of others. Okay, he will tell so many expectation of favor, everybody should help him, everybody should praise him, he will expect from others. Okay, what this narcissistic personality disorder thing? He will think he is the best. Okay, he thinks he is the best and everybody others are less important than him. He thinks he is the only correct person, everybody in the society are wrong. He is always egoistic, he is an attitude person, he needs admiration from others. Okay, he needs admiration from others, and he is having arrogance in his behavior. Okay, this is about personality disorder. This is narcissistic personality disorder. The next personality disorder we are going to discuss is borderline personality disorder. So what is borderline personality disorder? In this one, more important word I told you to remember is impulsive and risky behavior. Here it is. What is impulsive and risky behavior? So what is impulsive and risky behavior? I want you to just remember the word impulse. For you I brought the meaning of this word. See here the meaning. Note, a sudden desire to do something without thinking about the result. He will do anything without thinking what the result is. Okay, for example, the father saying the child that I am not giving phone to you. You are using more phone in a day, so that I am not giving mobile or a phone to you. So this what the child will do? He take the phone and he hit into the wall or hit into the floor, so that the mobile will get breakdown. Okay, understood? The mobile will get breakdown. After breakdown, if you ask why you did like that, this person will say, I don't know why it happened. It happened by itself. I don't know why it is. Why it happened means that is an impulse. Without his knowledge, it is coming out of his behavior. It is not he is doing. He is not doing with the intention. It is in his behavior. Okay, it is in behavior. That is impulsivity is in his behavior. So that he will show sudden anger. After we ask him why you did means he is not having answer, because he doesn't know about it exactly. Okay, what is risky behavior? He is always ready to take risk. Okay, he is ready for risk. Having unsafe sex, he is playing gambling, and he is binge eating. If the party is there, he will eat so much food. Okay, for risky behavior, most best and example is, okay, if there is a speed limit is 60, okay, the board is saying speed limit is 60, this person will drive 80, this person will say, we'll see what will happen, we'll see later. Okay, he wanted to take risk. So everybody others is saying, if you jump from that height, you will die. He will say, I will jump from that height and I will survive, because he wanted to take risk. He always having risky behavior in his personality. Okay, this person is always having unstable and fragile relationship, unstable and intense relationship will be there. Why? Because in all personality disorder, it is very difficult to maintain a healthy relationship. Up and down moods will be there, often as a reaction of interpersonal stress. Okay, this person is having interpersonal stress, because he is always sudden angerness will be there, impulse will be there. Okay, that's why he is having interpersonal stress will be there. Okay, the most important another word I told you to remember is suicidal behavior. If in question they are asking, in personality disorder question they are asking about suicidal behavior, okay, mainly it is present in borderline personality disorder. Okay, mainly it is present in personality disorder. In antisocial personality disorder also we have discussed, the person is harming self and others, but there is a motto, he wanted to achieve something, he wanted benefit. Okay, he is harming others for his own benefit. Here it is not there. Because of his impulsivity, he is having sudden suicidal behavior, and he is threat to self-injury only. He is not harming others. And frequent and intense display of anger. This is what impulse is. Sudden angerness will come for this patient or person. Okay, what it is? Borderline personality disorder we are discussing. We have discussed what is impulsive and risky behavior. What is impulse? A sudden desire to do something without thinking about the result. He doesn't know what the result will, he will do suddenly, because the impulsivity is commonly it is in his personality. So the sudden angerness will come. So he doesn't worry about the result. And what is risky behavior? He was always ready to take the risk. Okay, this person is always ready to take the risk. So this is what we have discussed about the personality disorder. So okay, this one is anti-personality disorder. He doesn't worry about others. For his benefit he will harm others. He break rules, and what is no control over his gratification. In histrionic personality disorder, what it is there? He is constantly seeking attention. Okay, in narcissistic personality disorder, he think he is the only god. He tell, I am correct, I am the king. He is always egoistic. His attitude, he always want admirations. Okay, this is what narcissistic. And borderline personality disorder, in this person, the person is having normally impulsive and risky behavior in his personality. Okay, we will see the questions that we have brought in the first this one initially. So we will see, which of the following is a subtype of dramatic or emotional personality disorder which is included in cluster B. Okay, I have shown the chart already to you. Paranoid personality disorder, it will come in cluster A. It will come in cluster A. What it will come in cluster A. This one also it will come in cluster A. Histrionic personality disorder, it will come in cluster B. Schizoid personality disorder, it will also come in cluster A. So answer is C. He is asking which personality disorder belong to cluster B. The option C, histrionic personality disorder, belong to cluster B. We'll see the next question. People with a borderline personality disorder often exhibit which of the following characteristics? Okay, in this question what he is asking? Borderline personality disorder. Okay, he is asking what is borderline personality disorder person is showing the characteristic. I told you to remember one word, that is impulsive and risky behavior. What it is? Impulsive and risky behavior. That is impulsive and risky behavior. The option A is saying unpredictable and impulsive. Yeah, he is very unpredictable, because sudden anger will come. We cannot expect when the anger will come, or sudden impulsivity of anger will come. So unpredictable and impulsive, this is the right answer. This one is uninhibited and promiscuous is not. Demanding and angry. Angry is there. He is not demanding anything. And sadness, it is not correct. The option A is the correct answer. See, this one about this is, see, 1, 2, 3, 4, 5 lines of question is there. Anyhow, there is a exam nearby, NORCET exam will be there. I wanted to tell you one trick. See, if you read a last line of the big questions, I am telling you last line of the big questions, you can read from here. Okay, you can read from where the comma is there. You better to read. Okay, from here in exam I am telling, if you read from here, you leave up to here, you from here, and he seems willing to say and do almost anything to get others to pay attention. See, you got the question here. He is getting attention from others. That is what the question is trying to say. This is all his whole drama. He wanted to confuse you. He wanted to waste your time. So better in especially where the comma is there, where the full stop is there. From there you read the question. Almost 70% the question will be understood. For example, you can say here comma is here. After comma is writing what is the nurse's role. So you will get to know. Previously only he is asking about the nurse's role. We'll see what the question is later, but he is asking what is the nurse's role. You will get initially you will get to know what he is trying to ask. So anyhow, in this question we will see the full question. Which of the following personality disorder is the best diagnosis for Claude? Okay, they are asking which personality disorder is suitable for Claude based on his characteristics. Claude goes to great lengths to be center of attention. See, he is always wanted attention. He announces his views and feelings with a great drama. He is excessive dramatic and excessive emotional. However, one soon suspect it is only for effect, and he seems willing to say or do almost anything to pay attention. Whatever he is doing to pay attention towards him. That's why he is doing. So I told you to word, if the attention, constantly seeking attention word comes, means the answer is histrionic personality disorder. Okay, borderline personality disorder is not the answer. In this one, impulsive and risky behavior will be present. In narcissistic, he tells I am only correct, everybody others are wrong. Okay, paranoid is always doubting others. Okay, we'll see the next question. I hope you solve the question. Okay. An inflated sense of one's own importance is seen in which one of these personality disorder? Okay, this one you can see one's own importance. What it is there? One's own importance is there. He is always telling his own. What it is? Own importance. He will tell I have done like that, I have achieved this one, I have cracked so many exams. He tells multiple times. Okay, he will tell that multiple times. But it is a own importance. We can own importance. He always tell about him admiration. This is what it is trying to say. Admiration and praise. Constant praise he need. That one is, see, antisocial personality disorder. No, it is not the answer. This one is not the answer. Schizoid personality disorder, no, this one is not the answer. Borderline personality disorder, no, this is also not the answer. Narcissistic personality disorder, he will tell I am correct, everybody are wrong, I am king, genius. Okay, he needs constant admiration and praise. He tells his own importance. Always he exaggerates his achievements. That is what he is telling. He is telling his own importances. I hope you got the point. We will see the next question. Okay. The client with the antisocial personality disorder. In this question, the person is asking, the questioner is asking, what is the characteristics of antisocial personality disorder is? What is the characteristic of antisocial personality disorder? Suffers from great deal of anxiety. No, antisocial personality, he breaks the rules in the society, he harms others for his own benefit. He has no control over his gratification. What he will do? He give anxiety to others by harming others. He is not suffering from any anxiety or nothing. He is generally unable to postpone his gratification. Yes, this is the correct answer. Unable to control over gratification. Okay, he is not having control on his gratification. Okay. Next question we will see. Rapidly learns by experience and punishment. This person is not going to learn anything. He is going to break the rules in the society. Has a great sense of responsibility towards others. No, he is having no responsibility. He always break the rules, harm the others. That is what his characteristic will come. So these all are the questions I have asked you previously. I hope how many of you got the correct answer we will see, and we will discuss some more questions also. Okay, we will discuss some more questions. Okay, you see this question for 2 minutes. You can read this question. Yeah, we'll solve this question. The term sociopath or psychopath is sometimes used to describe which of the personality disorder. What is asking? The term, what it is? The term sociopath or psychopath. It is used for which personality disorder he is asking. So the first option is histrionic personality disorder. No, this is not used for histrionic personality disorder. Antisocial personality disorder. Yes, of course, it is used in antisocial personality disorder. In society, they will say he is like a psycho. Then they are trying to say he is like a psycho. Then they are trying to say it is an antisocial personality disorder. Paranoid personality disorder. It is not the answer. It's also not the answer. Schizotypal also not the answer. The word sociopath and psychopath is related to antisocial personality disorder. We'll see the next question. The apparent lack of empathy and the tendency to exploit others for self-benefit. See, it came. He is telling exploit others for own benefit. He harm others for his own benefit and has led psychologists to compare narcissistic personality disorder with which one of the following? I told you. One personality disorder is related to narcissistic personality. The psychologists, they compared which personality disorder to narcissistic personality disorder. We'll see. Option A is saying histrionic personality disorder. No, this is not the answer. Okay. Antisocial personality disorder. Yes. In this one, he doesn't follow rules. He break rules. What it is? He break rules and harm others for own benefit. See, in this question also is asking same. He exploit others for self benefit. So, and in the same way, antisocial personality disorder is directly psychologists compared with the narcissistic personality disorder. See, next question, paranoid is the wrong answer. Schizotypal also is the wrong answer. The option B is the correct answer. Okay, next question is, typical core beliefs about self found in dash personality disorder might include I am glamorous, I am impressive, deserving of attention. By coming this one word, attention itself, you have to understand the answer. What the person is saying, I am glamorous. See, I am glamorous and I am impressive. I am very much beautiful. Deserve some attention. Okay. What the answer is? Yes, the option A is the correct answer. Histrionic personality disorder. So it is not the correct answer. In borderline, I already told you, impulsive and risky behavior will be there. In narcissistic, what it is there? In what is narcissistic? I am correct, others are wrong. Okay, this one is schizotypal, magical thinking and everything will come. See, I am telling you 4 lines you have to keep in your mind. Okay, these 4 lines, with these 4 lines you can understand this cluster B. If the person says, I am going to break the rules, I am going to harm others and I am not having control over my gratification, then it is called as antisocial personality disorder. If the person is telling the whole world's attention towards me, everybody attention should be towards me, then it is called as histrionic personality disorder. If the person says I am correct, everybody others are wrong and I need admiration, okay, I am constant admiration and praise from others, then it is called as narcissistic personality disorder. Okay, and if the person says I have impulsive and risky behavior, then it is called as borderline personality disorder. Okay, we will see next question in the next slide. Dash is characterized by a pattern of disregard for and violation of rights of others. I told you, if the violation of rights of others, harming others, violating the rights of others, then it comes under where is antisocial personality disorder. It is not comes under schizoid personality disorder, avoidant personality disorder and histrionic personality disorder. This is the answer is antisocial personality disorder. So next question is, typical core beliefs about others found in dash personality disorder might include they are favorable if they are attentive but terrible if they are not attentive or rejecting. See, in this question you are going to just find the word. See, he is asking where they are favorable if they are attentive but terrible if they are not attentive or rejecting. What is attentive? Attentive is nothing but directly getting attention only. Okay. Yeah, in histrionic personality disorder, if you give attention, then he is very nice to you. If you are not giving attention, if you are rejecting him, then his behaviors will be terrible only. So okay, this is not a dependent personality disorder. This one will comes in cluster C. We will discuss in next class. Option B is histrionic personality disorder. Yes, option B is the correct answer. Option B is the correct answer. Option C is borderline, it is not the answer. Narcissistic also, it is not the answer. In this one, what he is asking, he is constantly seeking attention from others. So we will see the next question. Typical behavior or strategies found in personality disorder might include dramatic attention seeking behavior. Again he is asking the same question. The person is asking attention from others, then it is histrionic personality disorder. This is not the answer. Okay, avoidant. These two I am going to discuss in next class. Okay. The next question is, dash is characterized by a pattern of grandiosity and need for admiration and lack of empathy. Okay, I forgot to tell you grandiosity. What is grandiosity? Grandiosity is like that only. I am king, I am genius, nobody, I am more important than others, like that. The feeling is called as grandiosity. He thinks he is the king, he is the boss for everyone, like that. That is the meaning of the grandiosity, and he needs constant admiration from others. What it is? He needs constant admiration from others. Then it is called as, you can tell what it is the answer. The answer is narcissistic personality disorder. So schizotypal personality disorder is not the answer. In this one, magical thinking will be there. In borderline personality is not the answer. In this one, impulsive behavior and risky behavior will be there. Histrionic also not there, because constantly seeking attention is the characteristics of histrionic personality disorder. The next question is, the core beliefs about self typical of dash personality disorder include, I am strong, rules don't apply to me. See what he is telling, I am strong, don't confuse here. What he is asking, rules don't apply to me. The one personality disorder, he is telling, I am born to break the rules. What he is saying, I am born to break the rules. If the no smoking board is there, he will smoke there only. He will go and smoke there only. Okay, I hope you got the answer. The person who break the rules, and that is called as antisocial personality disorder. The person who break the rules is called anti-personality disorder, and he is in the same way, he harm others for his own benefit also, and he is not having control over his gratification. So schizoid is not the answer in this one. Introvert characteristics will be there. Narcissistic also not the answer. Avoidant also not the answer. Okay. The answer is antisocial personality disorder. So this question is the last question of our session, today's session. Psychological treatment for the personality problems and adjustment is done by. So what is the treatment for this personality disorders? Okay, what is the treatment? Okay, you can answer for this question. What is the treatment? I told you there is no medical management is there. There is no hospitalization needed for these patients. So the correct is psychotherapy only we can do. In psychotherapy also CBT, cognitive behavioral therapy. What is CBT? Cognitive behavioral therapy. Okay, this is the treatment for this personality disorder patients. What is milieu therapy? Milieu therapy, nurses, doctors and all other healthcare department peoples, they will combine, they will work together for the patient benefit, then it is called as milieu therapy. If the nurse, doctors, whoever in the hospital that belongs to medical department, they all work for one patient only in the collaboration, then it is called as a milieu therapy. What is family therapy? Including family in the education of the patient, then it is called as family therapy. Individual therapy is given to single person only by the psychologist only or a psychiatrist. Individual therapy given to single person by psychiatrist. So this is what about cluster B personality disorder. I hope you got understood about all these personality disorder and questions, and this is we'll discuss cluster C in next classes, and today's this is all about today's class. Thank you one and all.